of 2021. Could I initially hand over to Craig Rogerson for housekeeping arrangements and meeting introduction?
Thank you, Chair. Good afternoon, everybody. I'm Craig Rogerson, the Democratic Services Officer for this meeting. I'm assisted by my colleague Jay Bell, who is host of the virtual meeting. This meeting is a public meeting held in accordance with the regulations which permit meetings to be held by remote means. The meeting will be live streamed for the public to view via the Public Eye platform, and Sheffield Live TV are also broadcasting the meeting. A copy of the recording of the meeting will also be available for people to view later through the Council's website. Public questions can be asked and petitions can be presented at Cabinet meetings. Details on how to do this are available on the Council's web pages and in the agenda papers. For this meeting, we have 11 questions that have been received from 5 members of the public by the submission deadline. For those in attendance at the appropriate time, the meeting host will bring questioners into the virtual meeting room to enable them to ask their questions. Once a speaker has asked their questions, the host will then return them to the virtual public gallery. And I can see, Chair, we've actually got all 5 speakers have now registered to speak. Before I hand back to the Chair to proceed to introductions, there are just a few housekeeping points to mention. To make the meeting run as smoothly as possible, can I please ask all participants in the virtual meeting room to have your microphone on mute when you're not speaking. When you want to speak, please physically raise your hand to the screen so that the Chair can see it. Only unmute when the Chair indicates that you can speak. If at any time any member loses the ability to hear or be heard, please alert the Chair, the host, or myself as soon as possible. Finally, members of the public may see members looking away from their screen at times. This is because they will need to look at an additional screen or device containing their agenda papers. I'll now hand back to the Chair of the meeting.
Thank you, Craig. And could I welcome to this first Cabinet meeting our new Chief Executive, Kate Josephs, and ask her, along with each member in turn, to introduce themselves. I'll ask each member as I see them on my screen. So first up is Terry.
Thanks, Chair. I'm Councillor Terry Foulkes. I'm Deputy Leader. I'm also a Cabinet Member for Finance, Resources and Governance.
Thanks, Terry. Paul.
Good afternoon, everyone. I'm Councillor Paul Wood. I'm the Cabinet Member for Neighbourhoods and Community Safety.
Thanks, Paul. Maz.
Thank you, Chair. Good afternoon, everybody. I'm Councillor Mazar Iqbal. I have responsibility for business and investment.
Thanks very much. Mark.
Thank you, Chair. Good afternoon, everybody. I hope everyone's keeping safe and warm at this time. My name's Mark Jones. I'm a councillor responsible for environment, street scene and climate change.
Abtisam.
Thank you, Chair. Good afternoon, everyone. My name is Councillor Abtisam Mohammed and I'm the Cabinet Member for Education and Skills.
Thanks, Abtisam. Julie? Julie?
Sorry, Chair, trouble unmuting. Good afternoon, everyone. I'm Julie Grocott. I'm the Cabinet Member responsible for Transport and Development.
George?
Thank you, Chair. Good afternoon. I'm Councillor George Lindars-Hammond. I'm the Cabinet Member for Health and Social Care.
And I'm Councillor Bob Johnson, the new Leader of the Council, and that just leaves us with Kate, if you would like to introduce yourself.
Thanks, Chair. My name is Kate Josephs. I'm the Chief Executive of Sheffield City Council. Really pleased to be here, and can I just say thank you for the very warm welcome I've received from Council staff members and all of our partners across the city.
Thanks very much, everyone, and thank you, Kate. Apologies for absence. Have we got any apologies for absence, Craig?
Chair, I think Councillor Drayton was just drawing your attention there.
Apologies, Jackie. I'm sorry. I didn't see you off screen. You jumped off my screen. If you'd like to introduce yourself.
Thank you very much, Chair. I'm Councillor Jackie Drayton and I'm the Cabinet Member for Children and Families. Good afternoon, everyone. And you also forgot Councillor Mary Lee.
I've seen Mary as well. She's now reappeared on my screen. So
Okay.
Mary, if you'd like to introduce yourself.
Yeah, so good afternoon, everybody. I'm Councillor Mary Lee and I'm Cabinet Member for Culture, Parks, Leisure and Libraries.
Apologies. Thank you, Mary.
Okay.
So Craig, back to apologies for absence. I believe there's none being recorded.
None received, Chair.
Thank you. Item 3, exclusion of press and public. Are there any items that there are no items that appear to be excluded from this meeting for the purposes of press and public?
No items, Chair.
Thank you, Craig. Declarations of interest. Can I ask whether members wish to declare an interest in any of the items of the business on the agenda? And if so, could you please let us know which item you're referring to and whether it's a pecuniary or personal interest, and outline the reason for the decision for the declaration. Any declarations? Thank you. Item 5, minutes of previous meeting. Can I ask members to approve as a correct record the minutes of the meeting held of Cabinet on the 16th of December 2020?
Agreed, Chair.
Agreed, Chair.
Thanks very much. Item 6, public questions and petitions. As mentioned in the introduction, there are 11 questions from 5 members of the public, and these are set out in your packs. Those in attendance will be invited to the meeting to ask their questions. Craig, could you please invite the first questioner in, please? Are we having trouble joining them to the meeting?
Anne Lesage here. I think you've now got me on screen.
We have. We've got you now.
Oh,
Anne,
good.
and welcome.
Thank you, Chairman. My question relates to the item that you'll be looking at that is Mary's interest, the restoration of Forge Dam. I chair the Friends of Porter Valley group, and I would like to ask, well, firstly say thank you very much to the council and all the staffs in Parks for their support. But my question relates to fundraising. We're going to be carrying on fundraising. We're aiming to get about another £30,000 in to complete the project, which will start, I hope, with your approval towards this winter. But my question is, can anybody in the council perhaps give us a clue, maybe this is crystal ball gazing, about when community events could be recommenced? It's something that the public absolutely love. COVID, of course, has caused them to be shut out for the time being. We don't know how long COVID lockdown will remain, but I just wondered if you had any speculative thoughts on that for us. We won't have a duck race this year, clearly, I'm afraid. And it's greatly missed. People are asking us all the time.
Okay.
Thanks very much for your question, Anne. Could I refer your question to Councillor Mary Lee, please?
Yeah. First of all, Anne, thank you for all the work you do, yourself and your organisation down to the Porter Valley. It's absolutely renowned across Sheffield, and certainly our officers love working down there with your group because it is so positive. So that aside, I would love there to be events in the summer, but we just do not know and we cannot say. So I'm not going to commit to anything at the moment. We're dependent on the situation in Sheffield and the situation in the UK, and obviously what government restrictions are in place. I hope we can have some events down there, and I know you do, and I would love that, but we just have to wait and see what we can and what we cannot do. So let's be patient and let's be safe at the moment. Thank you.
Thank you, Mary. Quite understood. It's the way things are. Thank you, Mr. Chairman.
Thank you, Anne, and thanks for your response, Mary. Craig, could I ask you to put Anne back in the waiting room, please? And the next questioner.
Right. Hello?
Hello, Mr. Hodson. Would you like to ask your question, please?
Yes, I will. I'm sorry it's quite a long question, but right. So these questions concern the True North Brewery proposal to lease a section of Millhouses Park as an extra eating and drinking area for the Wagon and Horses public house. Right, so question 1A. Now that the Parks and Countryside consultation, as is required by the Building Better Parks policy, is over, will the councillor, as Cabinet Lead for Parks and Countryside, commit to publishing the results of that consultation for the local community, park users, stakeholders and the public generally can be satisfied that the process has been robust, fair and transparent? That's the first part of the question. Second part, is the councillor herself satisfied that the consultation has been as robust, fair and transparent as it should be? Given that, and I've got a number of different aspects that I'd like to make.
Mike, can I just interrupt for a second? Because your questions are so long,
yes,
and people might lose track of them. Can I answer them one by one? Is that
fine, okay, yeah.
Just I think it's because I would. They're long. So the first question, yes, absolutely, we'll publish all the data that we've collected and ensure that everything is transparent and out there for everybody to see. And it'll, so absolutely guarantee that.
Okay, thank you very much. So next part is, are you yourself satisfied that the consultation has been as robust, as fair and as transparent as it should be, given that, first, it was not adequately publicised. Initially, it was only on the Citizen Space website, only later did it appear on social media sites, later still on the Chef News, and later still via posters in the park itself. So that's the first one. Secondly, the proposal was misleadingly described as a proposal to create a seating area in Millhouses Park, which just ignores the fact that if implemented, this area would no longer be part of Millhouses Park. It would instead be part of the Wagon and Horses public house. And that was confirmed by Lisa Firth, who was the previous head of Parks and Countryside some months ago. Thirdly, the only mode of response to the consultation has been via the survey on the Citizen Space website, which effectively debars anybody without access to the internet, or even many who lack the technical skills and confidence to navigate by that route. It potentially also allows responses from people anywhere in the world. And potentially it could allow people, individuals, to make more than one response. Right. Fourthly, the consultation offers few and sometimes misleading examples of the claimed benefits to the park or the local community. So for instance, the claim that the proposal would lead to investment in this area of the park ignores the fact that the Wagon and Horses investment would be in seating and serving facilities and in the creation of 3 gates into the park. All of those would have to be removed should the lease come to an end, and there'd be no benefit to the park as a result. Also, there's an claim that this investment would lead to jobs and/or training for local residents. But True North Brewery have confirmed in their planning application that the number of jobs created would be 1 full-time job, or equivalent to 1 full-time job. And there is no indication of how that could be limited to local residents. So again, where is the benefit? Nor is there any explanation of why Parks and Countryside Service might need extra income from this arrangement, or what alternative sources of income there might be. All right, so another aspect that there are aspects of the proposal that the Citizen Space text and survey does not mention. For instance, that trees will be felled or cut back, or and the proposal for 3 separate means of access into the space from the park. They're not mentioned. Right, lastly, there is a clear lack of balance in the information given and in the construction of the survey. the introduction clearly implies that if the planning application is approved, the proposal will go ahead regardless of the consultation. The final sentence of the introduction implies that the consultation is simply about how the lease would be shaped. Plus, most of the questions in the survey relate to what new facilities this area might have, all of which clearly assumes the proposal will be implemented, again, regardless of the consultation. Is this not unbalanced? As it appears to completely negate one of the councils and the local government associations guidance, prime rules of consultation is that you should start with an open mind at the beginning of the consultation and be prepared to modify proposals in response to its findings. Sorry, I know it's long, but...
Thanks for your question, Mr. Hodson. Mara?
Okay, well, first of all, we're waiting for the planning decision to go, whether this goes ahead or not, so we're waiting on that to happen. I'm happy that the consultation has been robust. It's been going on for a significant amount of times in various ways. Obviously this year limited in terms of how often we could get out into the park to consult, and a lot of this has been done electronically. We've had around more than 800 replies, which I think is a significant number of replies to such consultations. In terms of jobs, I think if it's one job or more, one job is better than no jobs. I think that's really good. And I am happy that the consultation has taken place fairly and has been a robust consultation. So that's the answer to your question. We've been round this a number of times. I know, Mr. Hodson, discussing the consultation, and I think sometimes I give the same answer. So, you know, and I haven't changed my mind.
Thank you, Mary, and thank you, Mr. Hodson. Could Mr. Hodson be returned to the waiting room, please? The next question I brought in.
I think there's more questions.
Oh, have you still got more?
I'm afraid so, yes.
Well, can we make it? Could we hurry up and get them out, please, Mr. Hodson, so we can get a response?
Right. Well, okay. Question 2. The consultation document discloses that the council actually owns the Wagon and Horses Public House, which is long leased to True North Brewery. Does this not pose a conflict of interest with the issue for the council, in that the council, through its property services department, as opposed to Parks and Countryside, would stand to benefit financially from any increased income and sustainability of the public house as a result of the proposal being implemented? And would the council explain how the council proposes to address this potential conflict of interest so that all benefits from the implementation would go to Parks and Countryside and not into the council's general budget?
Okay, so the pub is on a lease and the ground rent is paid, and any other additional revenue income goes to Parks and Countryside, not to property services. And there isn't a conflict of interest, as all council services work together for the benefit of the council and its residents. So, you know, as I say, there isn't a conflict of interest there.
Thank you. I'm not sure I accept the answer, but all right. Question 3. Yeah. The councillor has previously assured me that the proposal from True North Brewery, was robustly assessed in May 2019 against the process and the criteria set out in the Building Better Parks policy. Could she therefore explain why the copy of the assessment document, which was shared with me by a senior officer from Parks and Countryside last year, is dated the 24th of August 2020? And also, why the assessment makes specific reference to the planning permission process when the planning application was not lodged until June 2020, both of these dates being well after May 2019.
Okay, so the assessment was undertaken in May 2019, and our documents, I think, state 14th of May 2019. It was further updated with new information that became available, including the submission of a planning application in August 2020. And we referred to the planning process in the May 1919 version sorry, 2019 version, because we knew that the submission would be subject to a planning approval.
Okay, thank you. Right, so the second part of that question is about that assessment. How do you, as the councillor, reconcile conflicting claims in that assessment document? For example, under criteria 1, all income from the lease will be spent directly in the park and can therefore improve facilities. There have been statements from yourself and from past and current heads of parks and countryside that no such guarantee can be given. That's the first example. Under criteria number 6, it says that consultation has taken place with key stakeholders, example, local councillors, etc. But in October 2020, last year, you launched that consultation. So I would query whether any such consultation actually took place prior to that. And lastly, if you regard it as robust, the assessment against criteria number 10, which asks, is there any better alternative proposal, or is maintaining the status quo a better option? The answer to that was given as, no, the proposal is the preferred way forward. Would you not agree that is hardly a factual appraisal, and it falls well short of the council's normal requirements for proper consideration of alternative courses of action?
Okay, carry on. So the better part.
Sorry.
Sorry, should I continue, Bob? Yeah.
I'm sorry, yeah, no, yeah.
Okay, so the Better Parks Initiative recognises the need to invest further in the management and maintenance of the city's parks and green spaces. You know, we've had 10 years of austerity, as you know. Where income is generated within a green space, the ambition is to reinvest it within green spaces in the city. And this helps to protect the service from potential cuts in core council funding. It improves services, contributes to easing budgetary pressures by reducing the council's overall cost for delivering parks and countryside services. As with all income generated within Sheffield Parks, the needs of the specific park are balanced with those of all other sites in Sheffield. However, when the matter was first discussed with Lisa Firth, it was suggested that a proportion of the income from this leased arrangement, if approved, could be given to the Friends of Millhouses Park to enable their valuable work in the park. I think the Friends have rejected that offer at the time. What can be guaranteed is that 100% of this income will be used to support Millhouses and other parks in Sheffield. The initial, going on to your second part, initial early discussions and consultation was carried out in 2017 and 18. You were part of the consultation at that time. Further online consultation was undertaken in October 2020 as agreed with the Friends of Millhouses Park. And the last part of your question, no alternative proposals have been received for this small area, this small piece of land. In assessing the proposal that has been received from True North, the alternative of doing nothing has been considered throughout this, and maintaining the status quo is not considered the better option. This is partly subjective, as decisions around green spaces are not solely tick box exercises. The Better Parks criteria was developed as a direct result of your objections to this very proposal to ensure that the council could demonstrate a very clear method for making these decisions. And I think I've said much of that before, Mike.
Thanks very much, Councillor Lee, for your comprehensive answer, and thank you, Mike, for your questions. Craig, could we have the next questioner, please?
There, I'm unmuted. Can you hear me, people? Yes, I'm hearing, seeing that. Okay, good afternoon, Cabinet, Chair, officers, and welcome to Kate Josephs for her first Cabinet meeting. Welcome to the city. 3 shortish questions, all on the same theme, namely good governance. Would you, Chair, would you like me to ask all 3 together or separately? Hang on, I can't actually hear you. Let me look at my
Apologies, Mr. Johnson, I was on mute. Yeah, if you want to ask all three questions together, and then we can answer them accordingly.
Okay, Bob, that's fine. Thank you. Firstly, at this time of continuing and worsening financial stringency, and in the light of SCC's large reduction in turnover, particularly over the past decade, would the leader please attempt to justify 3 points? A, the cost of over £200,000 for an interim chief executive last year. B, the appointment of a new chief executive carrying a salary of 190,000 thereabouts, plus significant on costs. And C, the fact that the salaries of the most highly paid 7 officers amount to over £1 million, as I say, in a diminished council. Why was the obvious opportunity of Mr. Mothersole's retirement not taken to share a chief executive with neighbouring authorities, something I know has been mooted a number of times in the past, but it was difficult before? Does the leader or cabinet member concerned agree with me that this continued profligacy and disregard for obtaining value for taxpayers' money might be seen as a kick in the teeth by deprived people who want services delivered by the council? And that this wastefulness leads to further cynicism about politicians' decisions and, in many wards, contributes to very low voter turnout in local elections. Question 2. In view of the pandemic radically changing work patterns, purchasing habits, and unemployment affecting renters' ability to rent new apartments, it seems to me that the heart of the city 2, which is about 10 years too late, is likely to become an expensive white elephant. What financial risk is the council, the taxpayer in other words, liable for in the event of a failure to secure anticipated income streams for the project? Question 3. At full council 2 weeks ago, I was pleased with your answer to me, Bob, when regarding the style of governance used in the city, in that you didn't immediately, as Julie Doe used to, seek to defend the strong leader model and talk about the costs of an alternative. In view of that apparent flexibility and the sad fact that both of our football teams are currently in the doldrums, citizen spirits might be lifted if the council were to be the first major metropolitan authority in England to announce a plan to implement a modern committee system of governance. This would be a significant and progressive achievement, marking a new and dynamic era under your leadership, Bob, in the history of Sheffield local government. And perhaps no further embarrassing appearances in the London magazine Privatise Rotten Boroughs column. Thank you, Chair.
Thank you for your questions, Mr. Johnson. I'll try to attempt to answer your first and your last question, and I'll allow Councillor Iqbal to answer your second question. The first, in answer to your first question, once John Mothersole had confirmed his intention to retire, and we knew that there would be a gap between his departure and a new chief exec taking up position, it was decided that an interim would be appointed. The recruitment to this position was carried out in an open and transparent way and led by an officer employment committee and elected members. The ability to commence recruitment of a permanent chief exec was delayed due to the first national lockdown and the council's response to COVID. But the need for an interim chief executive to lead through that period remained, so the total costs of interim arrangements exceeded those set out in our outlined arrangements. The actual pay for senior officers is set out in our pay policy and salary payments to council officers and most senior officers, and are reported annually in line with transparency and other reporting requirements. So that's the answer to the first one. I'll allow Councillor Iqbal to pick up your second question.
Thank you, Chair, and thank you for your question, Mr. Johnson. I think we get value for money from our senior officers, couldn't function without them. And I'll give you an example why. As you may recall, Mr. Johnson, the Seven Stones project was an ambition of this city. Unfortunately, that didn't materialise, and the leader at that time, Councillor Doe, and myself, working with my cabinet colleagues and backbenchers, and I must add with our senior executive. This wouldn't have been possible without the senior executive. For me, they provide the advice, the information that enables me to make a sound and the best decision, not just for my constituents, but for the city. So yes, Seven Stones wasn't successful, and we decided to take a different approach in 2017. And the approach we'd taken, Mr. Johnson, was we'd go block by block, and I'll give an example there. So the HSBC office building, we were in a very fortunate position where we had a tenant who wanted to come into Sheffield, move from their existing premises and consolidate. So we were very fortunate there. We also took a decision, again, the advice provided by our senior executive, that we would like to get retailers that aren't already in the city. So we were very lucky to get Weekday and Monkey. And then within that block, we have CMS, which are a global legal firm that are based there. We have an independent Marmaduke's. So you've got that mixed tenure in there. And that leads me on to the project itself. Seven Stones would have caused me a huge problem, like it has done in other cities where retail, you've got these large retail outlets which are finding difficult, landlords are finding difficult to let. So our project includes leisure, retail, residential, office space, and new public realm. And throughout this difficult period, this pandemic, we've seen Angelo Gordon get on site, which is a build to rent residential scheme, roughly around £60 million of investment. We've had Radisson Blu, which is a global hotelier that have signed heads of terms. We've had New World Trading, which has got the Botanist on Leopold Street, which is opening a new restaurant, the Furnace, and this is within the pandemic. Very shortly, we'll be making an announcement on Leah's Yard. We've got tenants there. And the work the previous leader has done, and myself, around securing John Lewis in the city. And we know that unfortunately they had to close a number of stores, but have committed to staying in Sheffield. And the final one is the Isaacs building. Myself and the current leader and the previous leader, just before Christmas, went to the topping ceremony, which includes 52 apartments, townhouses and workspace. And then if we go on Carver Street, that office block is fully let. So I think our approach is justified. We're keeping the project and the city moving. So I disagree with the comment that you made. It's a white elephant, as I've read out. The project is a success, which is, if I can very quickly, Chair, through you, we've seen the regeneration, redevelopment of the Moor. The work we've done on Heart the City has levered in this extra 15.8 million of future High Street Fund, which connects that thread. And the final part of the jigsaw for me is Castlegate. So the city centre is moving forward. And the next policy for us which we'll be announcing in February, is how can we replicate that in our district centres? And Chair, we were also successful with the Stocksbridge Fund, Town Centre Fund. So the city is doing extremely well under these very, very difficult circumstances. So thank you for your question, Mr. Johnson, and thank you, Chair.
And thank you for your detailed answer, Councillor Iqbal. Your final question, Mr. Johnson. As you'll be aware, Councillor Fox, alongside the Overview and Scrutiny Committee, led on this work, and they also carried out the Big City conversation. I obviously will be looking into the issues raised in that conversation and how the council engages and makes decisions and is indeed held accountable. I understand that there was a lot of consensus around this work, and what we can do to make improvements through this work, I will continue to work with Councillor Fox and other colleagues to take these ideas forward. I hope that helps.
Thank you, Councillor. Thank you, Councillor Johnson. I do hope you're right and that you take any decision in advance of being forced to do so by the May referendum. Thank you very much.
Thank you, Mr. Johnson. Do we have Mr. Slack with us yet, Craig? Has he managed to join?
He's on his way in. Here he is.
Afternoon all.
Good afternoon, Mr. Slack. Would you like to ask your question, please?
I will. 2 questions for me today. Question 1. The first council meeting in January of 2021 was not a particularly edifying experience. Despite promising words from the leader of the council about working together better and getting away from tribal politics, it only took some minor baiting from the opposition parties for things to revert to previous habits, flinging comments across the virtual chamber, the Lord Mayor being disrespected, and cabinet members in the thick of it. Not a pun. It served, however, to highlight an issue of concern to this member of the public for some years. Back when the late lamented Harry Harpham was deputy leader, I asked a question about the unfairness to the public of questions item being hijacked by party activists to ask questions of council that promoted an openly party political response. Clearly a stooge in the public gallery, taking time from genuine questions from members of the public, possibly with questions prepared by their party. The person in question stood as a Labour Party candidate at the 2019 local elections. She was not elected. Harry Harpham's response was that she was a member of the public like anybody else. Is it therefore time the council adopted a protocol to prevent the sort of scenes we have witnessed at recent council meetings, where candidates and cabinet members have used the public questions arena as a battleground for the upcoming, or possibly not upcoming, local elections? Should political party candidates, or even just party members, be required to declare that affiliation when putting questions? Clearly all parties share some responsibility in the issue. Is it not time to grow up? And question 2, are we really in lockdown? You wouldn't know it from the traffic on the roads. On a recent exercise walk I took to the back streets around Healy Bridge to avoid the traffic. And yet I passed the following open businesses: a surface treatment company, a safety lamp manufacturer, a kitchen maker, including customers in the showroom, a van haulage hire company, an accountants, a carpet showroom, and various building supply firms. This is no doubt the impact of a looser definition of essential businesses, but also of insufficient government support for businesses and people in general during this deadly pandemic. Workers are effectively being forced back to work, and the negative impact on this so-called lockdown is inevitably going to cost lives. Once again, government is choosing economy over people's health, and this council can do nothing but follow orders. It's also reflected in the reports that some schools are dealing with 40% of their normal numbers still in school. How does this compare to the first lockdown of March 2020? With the country quickly approaching 100,000 deaths nationally, that's equivalent to 1 in 6 of this city's population, or to bring it closer to home, 3 people on this screen at the moment. And 700 deaths locally. What can this council do to make health the top of the agenda rather than the economy? When did council last meet with the city region mayor to push him to pressure government? And when did council last meet with the city's MPs to push them to pressure government? Thank you.
And thank you for your questions, Mr. Slack. Whilst your first question I'm going to take as a statement rather than a question, I will take on board what it is you're saying there, and I'll refer that second question to Councillor Drayton. But before I do so, I'd just like to assure you that I do meet constantly and regularly with MPs and the region's mayor. So I'll now hand over to Jackie for your question and answer to your question.
Thank you very much, Councillor Johnson, and thank you, Mr. Slack. Good to see you again. I think the points that you make in your question and your statement before the questions are really important. But we must remember that this lockdown is different. The rules of this lockdown are different from the rules of the previous lockdown. And you're right in saying that there are some businesses open this time that weren't open last time. And I think that it's important to remember that, and it's the same for schools. They have expanded the notion of key worker, and they've expanded the notion, the government have, and they expanded the notion of a vulnerable child and vulnerable children. So just to say, I think the rules are different, but the research shows on traffic movement, you know, they do use Google, I think it is, to make traffic, to monitor traffic movement. And the research shows at the moment, traffic is down in this lockdown. It has gone down, but is not as low as it went down in the previous one, the first one. And presumably that ties into people having to get to work that weren't going to work before. Because I, like you, last time it was so quiet on the roads, you hardly saw any traffic. And I've noticed, as I'm sure we all have, that the traffic has definitely been more, there's been more cars, but that's because of that, I think, that, and I think it's really important to notice that, to make note that we are lower. There is less traffic on the road, but more than before. That's your first question around businesses and essential businesses. I think the thing about, has the government chose the economy over people's health, and can the council do anything? Well, I think I have to say, Councillor Iqbal very eloquently described, in answer to Mr. Johnson's question about that Our Heart as a City project, and what the impact will have on our city economically, and for for our whole city, but for our most deprived areas, where we know there is a potential of unemployment going off the scale after the pandemic. And so anything we can do to ensure that those people have jobs, our people in Sheffield have jobs when we come out of this, and continue to have employment, is vital. Because I would say, if you look at Marmot and the Marmot report, and 10 years after, and Marmot's report on COVID at the moment, he claims, still rightly, I think, to improve people's health and to get people out of poverty, we need a good environment, good housing, good, which we're trying to do through Councillor Mark Jones, Councillor Mary Lee in our parks and in our environment, Councillor Paul Wood and our housing. Everybody's working hard to try and make sure, when we come out of this lockdown, that we will have all those 5 strands in place: education, training, employment, environment, housing, and that will improve people's health and improve their future potential and their future possibilities. I'm sorry, I'm just looking on my screen because your question's here, and I just want to go back to make sure I'm answering it all. You said quite rightly in your statement yesterday, and it was yesterday, the deaths in this country got to 1.610 in the UK, and it's just awful, isn't it? It's just awful. Who would have thought we'd have got to that point? And of course, it isn't acceptable. And here, but what we can say here in Sheffield, and you'll have noticed, because I know you do a lot of reading around this, and probably have a LinkedIn to Greg Fell, our Director of Public Health's tweets. You know that the figures in Yorkshire and Humber of cases are the lowest in the country, and that Sheffield has the lowest number in Yorkshire and Humber. Now that's because, and that comes to your point, are people following the rules, and that I think that shows people in Sheffield are following the rules, despite what the press says, that how they highlight some people not doing it. The people in Sheffield, and I think we should thank them for everything they're doing. Now, that not to say there are some people who perhaps need to be reminded what the rules are, and our police force and our environmental health officers are going out, and I suppose our vision has always been, our rule has always been, consensus is the most important thing. But we will obviously use enforcement if it's needed, but consensus and education and making sure people know that I think is really important. You also mentioned about schools. I've got a long answer from schools from Andrew Jones, who's the Director of Education, because you mentioned that some schools are dealing with 40% of the normal numbers. Well, there's a long answer, because at the moment the way the information is gathered is different from the first lockdown. The number of children, as I've said, that are coming into school is different, so it's quite difficult to compare. But he has given me some figures.
Could I offer a suggestion? That you're right to
yes,
Mr. Slack with that full detail, because it's quite easy to miss some of that data, and it will be a long and drawn out answer, I'm guessing.
Yeah, Chair, that's what I was just going to say to Mr. Slack, that I will send you the full detail, but just to reassure you that yes, there were some schools, 7 in the city, that had children for one day at least at 40%, but the vast majority were lower than that. But I just want, that's on, that's what your question you asked. As you said, what can we do to make health at the top? And I just want to say the outbreak control plan that we have, that was agreed by the Prevention and Management, the COVID-19 Prevention and Management Board, has still got our mantra. It's still the same mantra, which was to keep people safe, protect the most vulnerable, but reopen Sheffield. To keep people really healthy, we need children to go to school, we need businesses to be working and people to be working, and we need to protect them as much as we can. Stay safe, wash your hands, and make that stay apart. I just think, and also, of course, go and get tested if you need it. But and we've got vaccination coming, and I did want to say the vaccinations in Sheffield are some of the best in the country. The numbers that we're going through are predicted to be nearly 50,000 in the next couple of weeks, so that's great too. Thank you very much, Chair.
Thanks, Jackie, and thank you, Mr. Slack. Thank you.
Mr. Buxton.
Hello, Mr. Buxton. Can you hear us?
Hello, yes. Can you hear me?
We certainly can, yeah. If you'd like to ask your questions, please.
Okay, will do.
Thank you.
Thank you, Chair. Further to the Council committing to an archive of all information pertinent to the street tree felling programme, pursuant to the Streets Ahead contract with Amy. That was following the local government ombudsman finding the council had acted less than honestly. Could you please update residents with absolute details regarding the progress of this, including the specific remit, brief and timescale? With regard, question 2 has 5 separate parts. With regard to the civil injunction sought by Sheffield City Council and granted by Justice Mayles in 2017, against how many individuals were committal proceedings sought in court? Against how many individuals were costs awarded by court in favour of the council? Of the aforementioned, how many individuals have satisfied the said costs in full, and what is the value of these costs broken down individually? If there are outstanding costs, what are the individual values of any unpaid costs? And what action is being taken, and what is the plan to recoup any costs awarded by court from individuals that haven't yet paid those costs? Thank you.
Sorry, if I'd like to direct your questions to Councillor Jones, if you'd like to answer them, or whether you'd like to provide a written answer. Some of those are quite detailed and personal, probing into financial matters. So whether that's something that Councillor Jones feels able to discuss in this meeting, I'll leave to his judgment.
Thank you, Chair, and good afternoon, Mr. Buxton. I hope you're keeping safe and well. I'll answer your question in reverse order. The 5 parts question, officers are addressing that question now, so they're getting the information together for us, and we'll provide a written response to you on that one. So please bear with us on that one. With regards to the first question and the archive, I'm pleased to report that a project team has been formed under the leadership of Archives and Heritage Manager, Mr. Pete Evans. He is reporting to a project board led by the Internal Executive Director of Place, Mr. Mick Cross. Archive software has been identified for purchase and the procurement process is underway. The project board has had a first meeting and agreed to extend the timescale for the project to 2013. So I know this is something that has been close to the heart of many people involved in this process already. The whole period is to date until 2018, which covers the report from government. An analysis is underway to ensure that all stakeholders are identified and invited to contribute. So this is extending beyond the remit of just the council bit and actually hoping that other partners in the city can contribute to the archive. It is hoped that the archive will be launched in approximately 4 months, although there may be some slippage in that timescale due to the increased cover of the archive and additional content that we hope to get in there. But things are moving forward. We are trying to work as quickly as we can, and hopefully we can reassure you that will be coming online in a timely manner. And as I said, the question in 5 parts, I'll get the information to you in a written response, Mr. Buxton. So thank you. Have a good day.
Thank you.
Thanks, Mark, and thank you, Mr. Buxton. Craig, could you return Mr. Buxton to the lobby, please? Thank you. Item 7, moving on. Items called in for scrutiny.
None to report, Chair.
Thanks very much, Craig. Item 8 is now the COVID-19 update, and over to Greg Fell, our Director of Public Health.
Thanks, Chair. So I'll share my screen. Just hold on. About 5 slides. I'll talk fairly quickly to free up time and 2, free up time for questions. If members of Cabinet have questions.
I am painfully aware that you've got another appointment at 3:30, Greg. So if questioners could keep them as brief as they can.
I've rearranged a bit, so I'm happy to hang on for as long as there are questions, to be honest. So
all right. Thanks,
a fairly short set of slides. I'll talk about the epidemiology situation report as it is today, the reminder of the strategy, a medium-term forward look, and there's some crystal ball gazing in there, and a brief note on vaccination at the end, which is clearly one of the stories of the moment. So with no further ado, the epidemic curve over the course of the pandemic is there. From mid-October up until mid-ish December, the rate of infections was coming down quite markedly. It flatlined-ish. It was slightly rising from mid-December through to the end of December. Then it went up quite markedly from circa 125 cases per 100,000 over a 7-day period up till mid to end December. It went up to about 150, 160, and it went up quite sharply over the end of the December and the New Year period. You can see the curve for yourself. Currently, it's coming down. The 7-day incidence is coming down in both the whole population and most importantly within the elderly. As of today, stands at about 250. You should ignore the last few data points on the end. That's just a data lag issue. As of today, stands at about 250 per 100,000. Difficult to know where that will settle out. I don't think it will settle out to where it was in spring and summer last year. I think there's no two ways about that. I don't know how low it will go. Nationally, numbers of cases are dropping in London, the southeast, and most of the home counties, and that's important because it gives a significant amount of confidence that the measures that are in place are sufficient to hold the new variant virus. What caused London and the southeast to spike significantly was the transmissibility of the new variant of the virus. Sorry. The measures that are in place are sufficient to hold that, but they're not sufficient to make it go away. So difficult to know how that one will play out. But I think we're now on a downwards trend. There is still significant pressure in hospitals, and there are still deaths, and I'll come on to those in just a minute. It's worth me looking. I think I've shown this slide before, but it's worth looking at where we are epidemiology-wise in Yorkshire and Humber versus the rest of the country. The bottom right of the various squares is Yorkshire and Humber. The x-axis is the same for all of the charts. The growth up until the end of December was really quite marked in significant parts of east of England, London and the southeast in particular. That was not the case in Yorkshire. That was driven by the fact we didn't have at that time a great deal of the B117 variant. That's changed. We now do, but we're in a place where we've got some really quite restrictive measures, not as restrictive as they were in March, as Councillor Drayton's already pointed out, but sufficient to hold the virus. And actually, what we've seen is the impact of Christmas is now beginning to wear off. So most of the growth, it's worth me saying, where there is growth, is in the working age population. They are out and about more, they're at work, and they're travelling to and from work. The rates aren't growing really at all in school-age kids and are not really growing at all in the elderly. In fact, they're coming down in the elderly, which is quite reassuring. Hospitals remain busy, and this is the chart on deaths, but I'll just pick up hospitals here. Our hospitals up and down the country, but our hospital is in a period of really sustained pressure. In the order of somewhere between 15 and 20% of acute beds have a patient with COVID in them, and that is having an impact. That's having a knock-on impact in the ability to provide other care. It's fair to say the NHS is still open. Both primary care, social care, and our hospitals are open for business and are still providing great care. But the whole of the health and social care system is in a period of very, very sustained pressure. Our rates, whilst they're coming down, are too high. That gives very, very, very little room for manoeuvre. We cannot and must not do anything that will increase the pressure on the NHS and social care system, because that will come with some consequences. So all up, epidemiology-wise, sorry, I should say that it is a virus that's very easy to spread, and it still kills people. This chart, which I've skirted over, one of the more important charts, is the deaths both in hospital and community over the course of the pandemic. And you can see there's been a significant rise from October through to November, came down but has gone up, and there will be a long tail in deaths, because there will be further deaths, I'm sorry to have to say, and that's the people who are now very poorly and in hospital. Sadly, some of those people will not survive. I would expect to see death rates now start to tail off as the case rates have tailed off. So that is welcome news, but there will be a lag on that. All up, epidemiology-wise, R0 is still above 1. I think that will come down. I think that's a week old now, and I think that will start to come down to R0. We'll probably get back to just below 1, only just below 1. And I remind everybody that in the summer gone, R0 was 0.6 and the case rate was very low. Now we'll probably end with R0 just below 1, but with a much, much higher case rate. Less than 250 cases per 100,000 population in 7-day period and falling. That's good news. Positivity, the proportion of people who have symptoms who get a test, who test positive, is falling. A week ago it was about 14.5%. Now it's 11%, and that's going down. A significant proportion of our hospital beds have a patient with COVID in them, some of whom are really very poorly. Our hospitals aren't in the same position as London and the South East, but it's still a very, very difficult to manage scenario. The new variant is in our town. A significant proportion of tests are new variant, certainly more than 50%. Thus, I remain of the position that there's little to no room for manoeuvre. Our numbers are much, much too high for comfort. Our plan is largely intact. I've seen the slide before. Just a reminder of the plan. There are named leads and a programme for each of the main things within the plan, from prevention through to settings of concern, which does include care homes. And there's a fairly well established infrastructure to deliver that. We're having a fairly light touch review of that at the moment. The fundamentals are still intact, actually. And the fundamentals of the delivery of it still work and are still intact. We keep adding to the plan. Asymptomatic testing we are getting into in a targeted, limited way, and the vaccination programme is running quite well, and I'll pick that up right at the very end. We will be developing the plan. I'll be recommending that we develop the plan as well for ready for when we come out of lockdown. I think because of our differential position epidemiology-wise, comparing Yorkshire and Sheffield within Yorkshire to the rest of the country, we'll have much, much lower rates than the rest of the country. Some speculation as to whether we should pursue a zero COVID strategy or manage COVID as an endemic disease. It is an endemic disease now. Honestly, I think zero COVID is a noble ambition, but really quite difficult to achieve. So I think we'll be in a position where we have to manage COVID as an endemic disease, and we will have to act accordingly for some considerable time to come. We have control of some of the tools that we need. So our approach to our own strategy, clearly we're in charge of that. Our approach to comms and the services and support that clearly we're responsible for, but we fit into a wider context that we don't have full control over. So the government approach to comms, we have to fit our comms within that. Testing and contact tracing are not within our control. They are either Department of Health or more to the point, NHS test and trace, NHS test and trace control. We have some elements of control, but the big levers are without our control. Isolation payments is quite hot in the media at the moment, quite rightly and understandably, and national guidance, which is national, losing the title, it's not within our control. So where I think we'll go with our development of the plan is continue to push for rapid test and rapid test result for those with symptoms. By far and away the most important part of the testing. More rapid and more complete contact tracing, either what we do with our team or NHS test and trace. Honestly, I don't care which, but we need to have more rapid and more complete contact tracing. Better support for those who are asked to isolate, especially financial. Again, that's quite hot in the media at the moment, so I won't comment on that there, other than the fact that we do need to provide the right kind of financial support. And the long-term adaptation of the city. I think we will be living with COVID for the foreseeable future, and obviously that goes without saying, high coverage of vaccination. When will it all be over? The forward look. It's impossible to know, in short. I think the lockdown is having the impact it's expected. the vaccination programme I'll come on to at the very end. Huge progress has been made there, but it doesn't shift the need for the basic public health measures to be in play. The vaccination will impact on mortality and hospitalisation. We don't know whether it has an impact on transmission yet. So the variant, about 60% of the 60% of cases are the B117 variant. It's more transmissible. That has an upward impact on transmission. I measured by R0. The mitigation measures are exactly the same, but a lot more vigilance is needed. I think that will lead to a higher baseline rate when it settles, when the current downward trend settles down. It will still be making people poorly. Some of the people who get poorly will become very poorly and will end up in hospital. So pressure on hospitals will continue for some time to come. The business end here has always been between or within, but particularly between household transmission. Yes, we will have outbreaks in confined settings, care homes, schools, not many actually, and they're largely contained. The real spread is household to household transmission. Core fundamentals do remain in place and have been there from the start and will be there till the end. The when will it end is the crystal ball gazing. My suspicion is that from mid to late February, the tide will begin to turn, but quite slowly. Enough of our population will be vaccinated by then to have a reasonably substantial impact on mortality and hospitalisation, possibly on transmission, and we will be spending more time outdoors, but we'll still have nowhere near enough coverage of vaccination to resolve the problem. So I do think we'll be in a space where we're living with COVID for at least until summer. And I don't want to be the purveyor of bad news, but I don't think it's right or reasonable to think that this will all be over by spring, because I honestly don't think it will be. We don't know the extent to which the virus may mutate further. That has happened, and we've seen the impact of that. So I think we'll be in a position where we need to be careful for some considerable time to come. Lastly, before I be quiet for just a sec, vaccination clearly is happening. Many tens of thousands of people have been vaccinated across the 15 primary care hubs and the hospital vaccination centre. Credit to the NHS. It's been a huge effort by the NHS, supported by both the voluntary and community sector and the council. And it's been a significant effort. I've said before, it's probably the biggest logistic exercise that the NHS certainly will ever have to undertake, and it is going well. As I say, tens of thousands of people who are the most vulnerable in terms of severe impact of COVID have been vaccinated. There's more to do, no doubt about that, but thus far that is going well. We are beginning to coordinate that a lot better. The individual pieces are working pretty well. We are seeking to coordinate that, not to take over, but to coordinate. And there are some operational issues that need to be attended to. As I say, there are uncertainties. We genuinely don't know the extent to which the vaccination reduces transmission. It certainly reduces the risk of death and hospitalisation, but it may be that I can still acquire the virus and have a much lower level of illness, but still transmit the illness. And the one thing that we cannot do is allow the virus to circulate freely in a population that is unvaccinated, because that's inviting a further mutation and or vaccine resistant virus, which clearly wouldn't be good for anybody, because even those that would be vaccinated would be not protected, who have been vaccinated would be not protected from a vaccine resistant strain of the virus. So for that reason, I think we will continue to be in a space where we're living with COVID and washing our hands and keeping our distance and getting tested if we've got symptoms for some considerable time to come. And as I say, I think summer is optimistic, though I think the tide will turn from spring as we get more outdoors, more outdoors and less indoors, and there's some element of seasonality there. So on vaccination, it is a good news story, no doubt about that, but I just want to be clear, it is not the single or sole solution to the end of the pandemic. And I shall stop there, Chair, if that's okay.
As ever, Greg, thank you for your update. Does any member have any questions of Greg before we allow him to go? I can see Mark Jones indicating. Mark, if you'd like to ask your question.
Thank you, Chair. There's two there for you, Greg. One of them a bit easier. The positivity test of 14%. Is that a sensitivity artifact, or is it anxiety in people seeking the test appropriately, but not actually necessarily having COVID? And you mentioned the no COVID approach. What would that strategy look like, and is it actually achievable given Sheffield's global connections? Because I'd kind of always worry about how would you stop COVID, even if we did get rid of it, being brought back into the city just to people moving around and bringing it with them. Thank you.
So in reverse order, I think zero COVID is a worthy goal, definitely something to aspire to, definitely something that we should seek to do. It's fair to say that many cities around the world have achieved it, most famously cities in Australia, most of New Zealand. Their context is really different to here. And we're very densely packed population, which New Zealand isn't. Melbourne, but Melbourne, to be fair, has just about achieved zero COVID. But the city of Melbourne has pretty much, I think, control over all the tools which we don't, and it probably is better able to exercise control over all of those things. So I think whilst I would seek zero COVID, I do wonder about its achievability. So I think we'll get into a position where we're aiming for as low a possible a rate. Zero is the goal, but I do wonder whether or not we'll get there, to be honest. Certainly from a baseline of 120, say we get back to a baseline of about 125, 150 cases per 100,000 in 7 days, that's a massively different position to where we were in summer, where cases, I remember sweating profusely when cases went up from 25 to 30 per 100,000, that was a much easier caseload to manage than what we've got at the moment, but we should still aim for as low as humanly possible. On the testing behaviour changed a little bit over Christmas because people didn't want to seek a test because they didn't want the implications of isolation. But over a longer period of time, nothing much has fundamentally changed on testing behaviour. So I think the positivity is a true reflection. So of 100 people with symptoms that they think are COVID, the three classic ones are most to the point. That seek a test, 14 to 15 of them about a week and a half, 2 weeks ago would have tested positive. Now it's 11%. There's less disease there, and that's a good thing. And the impact of lockdown is clearly having an impact. It's fair to say that most people are obeying the rules, but the thing that the two areas I watch for most are the ability of those on low incomes to isolate, the financial affordability of that. That's the evidence is really clear there, really clear. And the second one is households to households transmission. I take something round to my neighbours. That's an opportunity for a virus to spread. It's a really minor lapse. It's really easy to do, but that I think is where a lot of the risk is. So that happens, but all one, lockdown is having the desired impact, and two, the reality is that most people are actually complying and obeying the rules, and thank you for it, because it has made a difference.
Thank you, Greg. Thank you.
Thanks for your question, Mark. I've got another question from Councillor Paul Wood. Paul, if you'd like to ask your question, please.
Yeah, Greg, mine's a very simple question, really. Just prior to the start of the first lockdown, I had a few days of a really bad cold, but since then, as my colleagues know, I've had major breathing problems which have not improved at all. When can I get a test to find out if I actually contracted COVID? Because it's to put my mind at ease in a way, if I knew that's why I got these problems now. But when will I be able to have a test that shows if I've had it? Because I understand if I go now, they can only give me a test to say if I've got it now, but not if I've historically had it.
Yeah. honest answer, Paul, is we're not offering routine antibodies. The antibody test that will tell you, have you had the illness at some point in the past? And we're not offering, the city or the country, I don't think, is offering antibody tests at any scale at the moment outside the Office of National Statistics Surveillance Survey and one or two other pieces of fairly niche epidemiology. There is a plan to scale up antibody testing as part of the monitoring the impact of the vaccination programme. But I honestly think it's unlikely will the NHS or anybody else will be offering routine antibody tests to the general public at any point in the near future, because there just isn't the capacity in the NHS to do the lab work. Sorry.
Thanks for your question, Paul, and thanks for that response, Greg. I've got a further question from Councillor Iqbal. Maz, if you'd like to ask your question.
Yeah, thank you, Chair. And Greg, once again, thank you for your presentation. It's good to see we're leading the way. One of the questions I'd like to ask is regarding the vaccine. I hear we're doing really well regarding the 4 cohorts. Something that I've just picked up locally. I know we're trying to get as many people vaccinated as possible, and sometimes folks are being asked to visit a different GP. And how is that data collected and then shared? How does somebody know that Mr. Johnson or Mrs. Wood have had a call, didn't answer, not had the vaccine? Where's that information collated, and is it shared with yourself and public health colleagues so we can go out and proactively ask these people to take the vaccine? The reason I mentioned that, Greg, I was listening to BBC Parliament, and it sounds very sad. It was when the Prime Minister was being questioned, and it was about data sharing, and that data sharing is equally important as the messages we put out there. The reason I mentioned that is because are we seeing gaps, people not getting, those hard to reach individuals, if they miss a phone call or not sure because it's a different GP name. And again, transport is a key prohibitor. I mean, I can use my ward as an example, Littledale in Greenland. The bus is a bit like Christmas, comes once every year. If you've missed that bus, you've had it. I won't use Eid as an example because we have 2 Eids. So, but on a serious note, for me, it is a genuine concern. One about colleagues getting that information, and be about, those hard to reach older people in our communities where public transport just isn't up to the job. Thank you, Chair, and thank you, Greg.
Thanks, Councillor Iqbal. So transport, we are doing our best on transport, actually, and many of Mick's team are providing active support to people who've identified that they haven't got transport. I don't think we've quite yet got to providing buses to transport people around, but we are ready to do that as and if it's needed. On data, it's a concern for me. I don't have the data I don't have the data beyond the number of people in the initial priority cohorts that have received vaccination. As the numerator of the equation, I have no more than that. I'd like to have a lot more than that, and with consistent ask of NHS England to share that data with local directors of public health, not just me, but up and down the country. But most importantly, GPs do have that data. And the way they're organising is around primary care networks, of which there are 15 hubs that are run by collectives of GPs responsible for vaccinating their registered patients across each of the GP practices in that primary care hub. They do have a list of who's been vaccinated, who's been invited, who's been who's turned up, and who's had the vaccination. One of my slight concerns, and this is one of the things that we need to address in the next few weeks, is the fail-safe. If Mr. Smith at number 44 doesn't turn up, who follows up on that one? Now, the NHS clearly need to follow up on that one. We will help them either through voluntary community sector organisations or through our own staff. But currently we don't have the data to enable us to help us to do that. So that's one of the concerns. Admittedly, we need to make good on our offer, and the NHS needs to help us make good on the offer, because it's the people that we will inadvertently miss that concern me most. So that's work in progress, to be honest.
Just very quickly, if I can comment to the leader and the new chief exec. I know Councillor Johnson has regular meetings now with ministers and civil servants, and Kate will be joining. I mean, to hear Greg's concerns, hopefully you'll pick that back up and feed it up the chain. Thank you very much, Greg, for your response.
Thanks for your question, Councillor Iqbal. Comments will be taken on board, and obviously them conversations will take place. I can just see a comment from Councillor Mary Lee. Mary, if you'd like to just make your comment, please.
Oh, just very briefly. It's just point out that, obviously the council and voluntary sector and the health service are all working together on this. And just an example from my area, one of the GP practices that is administering the vaccine, when people were turned up a few days ago or last week, the weather suddenly became bad. We were out there, the council were out there immediately putting up gazebos and helping people stay put and have the vaccinations. And I think that example went out on social media and through people's networks, on phone calls. And, I think it's just really, really heartwarming to see that kind of thing happening, and we can all work together really quickly and swiftly. And I know we're doing it all the time, but I just thought I'd raise that as an example of how it all works sometimes very, very quickly.
I understand it was Mr. Crofts, Mick Crofts, so great to see. Well done.
It's probably our events team, because they are doing that stuff. Yeah.
I'd just like to put on record at that point my personal thanks for volunteers and staff that made all that possible and continue to make that possible. Greg,
it's a story I hear consistently, actually, from GPs up and down the city. They are incredibly grateful for the efforts that our teams, particularly it's one of me, it's Mixed Events team that have done a lot of the hard work, and also voluntary community sector organisations, consistently, immensely and immeasurably grateful for the work that various people have done to enable the clinicians to do the actual vaccination. So and I hear that story consistently, have done for the last week and a half, 2 weeks, 3 weeks now.
Thanks, Greg. And just before I let you go, I did say I'd try and get you away for 3:30. I've just picked up a late question that I'd missed out, so my apologies to Councillor Linders-Hammond. George, if you'd like to ask your question now.
No
please.
problem, Chair. Only one very brief. I just want to reflect, and thank you for the report, Greg. I just want to reflect that what you said within your report about how where there are rising case numbers, it's largely within working age populations. There's been some comment in the media this week, but it's something that I think is only something emerging within the public narrative around what impact that the change of attitude from workplaces, leaving aside what is legally open in terms of shops and public facing things, but the change in attitudes from employers towards whether or not they're allowing their employees to work remotely or not. And I wondered whether you felt that given that perhaps we expect into the spring the more vulnerable groups to be better protected, whether you felt that currently the government has the balance right in terms of the message they're sending to employers around enabling remote working and therefore avoiding those particularly close circumstances within workplaces, given that it seems on the face of it to be quite a different situation again from what we saw in March and April. Thank you.
I think so. I think nothing much has changed with regard to the government's approach to what I mean. This lockdown is less tight than the previous lockdowns, no two ways about that. But I think fundamentally, in terms of the messages that government are sending out about what COVID secure means and doesn't mean, and enabling remote working as and where that's possible, I genuinely don't think anything's changed on that. Employers may have changed their predilection for risk but I don't think the government message has changed. There may be something that we want to do about working with employers around how we best manage risk. I think, to be fair, up to date, most employers have managed that really, really well. I've not clocked that there's been any substantial change amongst the city's employers or more broadly, but it's something I'll look into, and we'll test. Is our story and our approach to that as robust as it can be? Sheffield Chamber of Commerce is a member of the Coronavirus Prevention and Management Board, so I'll test that with the reps there and get a sense. You know, some people will need to do face-to-face work in order to be employed, but the general message is, if you can work from home, do work from home. And I don't think that has changed much, if at all. Actually, people's attitude to the risk may have changed a bit.
Thank you, Greg.
And as ever, Greg, thank you very much for your
Pleasure.
time and for your contribution. It is much valued by not only this organisation, but citywide. So again, thank you.
Thank you. It's team effort. Thank you, though.
Moving on, we're now moving on to item 9, retirement of staff. This report details one member of staff who was recently retired from the council with over 20 years experience of service, a Denise Cliff, teaching assistant from Ecclesfield Primary School. Cabinet are asked to convey the council's thanks for her work and extend its best wishes for the future for a long and happy retirement, and they request an appropriate extract of the Cabinet resolution under the Common Seal of Council to be forwarded to her. Is that agreed?
Agreed, Chair.
Thank you. Moving on, item 10, 8-month capital approvals. We have a report to be presented by Damien Watkinson, and over to you, Damien. Thank you.
Hi, I'm Damien Watkinson. I'm the finance manager for the capital team. I'll not go through all the detail of the report, but just pick out the key points. So the additions that are coming through to the programme this month, the Little Kelham Bridge, so a cycle and footpath bridge being installed at the Little Kelham site that's going to link the housing and the museum and provide a link in the Upper Don Trail. It's going to be delivered by the developer who's on site, Situ, and funded from Section 106 agreements in that area. In transport, we're increasing the budget by 945k with Transforming Cities funds monies that we're drawing down from the city region to continue the planning around active travel. In terms of open space, mentioned earlier in the questions, Forge Dam, so that's coming forward for the desilting of that pond and the improvement of that area, and also a new park at Westfield. Just to say, both of those are being delivered with a large proportion of funds that have been raised by the local people there in Westfield and the Friends of Porter Valley. In terms of housing, we're investing at Mearsbrook Park Road. There's a property there that's going to be upgraded to provide temporary accommodation to help with housing need, and also new housing at Derbyshire Lane, where some land's to be purchased to provide new council housing. In schools, we're providing some additional SEND provision at Chancellor Wood Children's Centre, so some refurb works going there to provide some extra SEND places, and also some fire risk assessment work being done at key priority sites that have been identified in the school's estate. I'd just say then there's an appendix which pulls together several projects within the Transport and Heart of the City project schemes, where we've got a lot of reprofiling and slippage of funds into future years, which have come to about 24.5 million. And I think that's just seen the impact that COVID's had on the capital programme. So what we're doing is bringing those forward and moving those budgets on to next year, and they're all detailed in Appendix 2. We also have an Appendix 3 to this document, because later on in the agenda you've got the HRA business plan, the annual business plan, and our Appendix 3 just reflects the capital element of that. So 5 years of the capital investment programme are currently reflected in the capital budget, and this appendix really just describes mostly it's the 5th year that programme now goes in, 25-26, as we move through the years, so that we've got 5 years of a programme still in, and that's roughly an investment of 67.6 million going into that year. Within that report, there's also details about how elements are moving on between years and being reprofiled. But really, this is just indicative themes that come forward at this point, the themes that we'll be spending the money on, including, of course, the stock increase programme. So that's what's within that Appendix 3. And then we also have an Appendix 4, which relates to us passporting the money onto the provider of the bridge at Little Kelham that I mentioned earlier. Actually, I know it's quite a long report, but they, as far as I'm concerned, are the key additions there. So if anybody's got any further questions on that.
Thanks very much, Damien. I think I'm picking up, we've got 3 comments, so I'll just take them in order that they've popped up. So Mark, if you'd like to make a comment, please.
Thank you, Chair, and thank you for the report, Damien. I'm particularly pleased to see the work going on Little Kelham to get the cycle paths working. Anything we can do to encourage people to use active transport is always welcome, certainly as we look to address climate change. But also, given the flood warnings that we've got across the city, and I keep glancing out nervously at the weather outside the window here, the ongoing works to try and deliver enhanced flood defences for the city. It's a little disappointing that the flood defences aren't in place as we would like them to be, but it is good to see that we have a great ambition to continue to work with all partners through these difficult times to deliver those flood defences, and we're continuing to apply for additional monies from the EA to bring in further enhancements. So cheers for bringing that to attention, Damien, and keep working hard on making sure we can get those monies spent and those projects delivered.
Thank you, Mark. Councillor Lee, Mary, if you'd like to make your comment, please.
Yeah, thank you. Obviously 3 projects here from Parks, but I just wanted to mention Westfield Park, which is quite a small project, but the idea was brought to me a few years ago by Tony Downing, who is our Lord Mayor, and David Barker as a councillor then in Mosborough, and Mike Peat, who people might know. I think he was the chair of Westfield North Local, big local then. And that was they brought this idea with them and some money. And I just wanted to point out that council services, housing, public health, and parks have contributed. So this, points out to Mike Hodson raised it before about council services working together. And just want to point out that council services do work together to develop projects. And so I'm really pleased that that project is going ahead in Westfield Park. Equally, health and safety works in General Cemetery, much needed, but a part of a massive, much bigger project that's going on down there that is a really fantastic place for the people down there, and one of the only green spaces they've got down in that area, in the Sharrow area. And Forge Dam, and you heard Anne talk about that earlier, and I just want to say thanks to them again, and also thanks to our park services, who obviously they work really, really well with. And also, just lastly, to point out in this difficult time, our outdoor spaces have been actually, really, really a boom for people in Sheffield. And going forward, it's not going to stop. Even when people are vaccinated, we are still going to be able to spend much more time out there in our community, on our outdoor spaces. And I think that's what we need to be working for. And I'm glad, Sheffield Parks are very much valued by everybody, as we know from the big conversation. And we will certainly want to promote that even further going ahead.
Thanks very much, Mary. Thank you. Thank you. Councillor Mazar Iqbal.
Thank you, Chair. Just echoing what colleagues have said. Thank you for the report, Damien. But it's good to hear that we've not stopped. We're reprofiling, continuing that connectivity work in the city centre. But I'd like to also point out AMID, the Advanced Manufacturing Innovation District. The opportunities that brings in. We've seen a number of global companies over the last few years, like Boeing, McLaren, and others, and trying to get some of these young people, if I use them as an example, the apprenticeships, not just from Sheffield, but from Barnsley as well. I remember meeting a young girl who had to get up at the crack of dawn, something like 5 o'clock in the morning to get to AMID. And this project enables that connectivity in our own wards as well. So having that connectivity, that ambition to ensure that, all people, including our young people, the apprentices, are able to benefit and are able to apply because they know they can get to their workplace. So it's really good to see that Amid, the work around Magna and the city centre is still progressing, Chair. Thank you.
Thanks, Maz, and thank you for your report, Damien. Thank you very much.
Thank you.
That brings us on to item 11, the HRA Housing Revenue Account Plan and Budget for 21-22, and the presenting officer will be Janet Sharp. If Janet's available.
Janet, you're muted.
Sorry about that. Sorry. This report comes along to Cabinet each year to make sure we are focusing on prioritising the housing revenue account to deliver our strategic ambitions for housing in the city, and particularly for council housing. I won't go through all the detail in the report, but there are a few things that I just want to pick up from the report. So each year we do that detailed review, we check our strategic priorities, we make sure they're aligned with corporate and city priorities. We look at our income assumptions, our spending assumptions, both on an annual basis and also over the 30-year period, and also take on board the regular national and local policy and regulation changes for housing to make sure that we've got good quality accommodation, we enable people to be able to access good quality and good council services to support our tenants in the city. The review couldn't take place, without the hard work of our tenants, without our hard work of our elected members and officers from across the council who work with us to make sure we've got all the checks and balances in place and to make sure we're prioritising on the right things. So we are fortunate that Sheffield has a strong track record with its HRA business plan in delivering strategic priorities, and also probably has one of the strongest and most robust business plans. And because of that, we've been able to bring forward, some quite significant programmes, particularly increasing the supply of affordable housing. There's a few things within the report that I just briefly want to pick up on. We are making sure that it delivers, the priorities that have been set by Cabinet through its strategies. It is about maintaining our commitment to delivering 3,100 new and affordable homes for the city, where possible. And also we are looking at how we may be able to build on that 3,100 and see how we may in futures be able to expand that through obviously levering in the many millions of government funding that we get towards this programme from government and city region. So we've also this year needed to look at how we improve our stock and deliver management arrangements in terms of fire safety, and new regulations obviously have come in that means that we need to spend more money, particularly on our high-rise and high-risk buildings. And also we've been able to maintain, and we have a comprehensive programme of capital programme works that Damien's alluded to as part of the programme. So a few £100 million will be spent over the next 5 years on the stock, on properties, on new homes, on acquiring additional properties for the HRA, and also that wider environmental things that we need to do with the stock, and also make sure that the environment, the cleaning, the way we manage the stock is the best it can be. The report this year also focuses on climate change and how we get the stock from where it is now to get as close as possible to zero carbon. So the report recommends that within the next 10 years, every property will be at EPC-C, but also by utilising the external funding that is available, we should be able to better that to get much closer. and we'll bring back to Cabinet obviously more detailed proposals on that in the coming months. We've also obviously reflected on the impact of COVID that's had on our customers and additional hardship and support that has been available by the council, not just housing but all council services, to make sure that people do feel supported and are not worrying about losing their homes during this period, and also doing what we can to make sure that we are preventing homelessness. There is also a key theme within the report that runs through about using our buying power with the HRA to make sure that that we are able to secure local and new jobs from the city, apprentices, making sure our supply chain and particularly contractors are using local labour wherever that is possible. The report recommends increasing rents as per national guidance and similarly for garage rents, but all other recommendations are recommending that budgets stay as they are, apart from obviously community heating, which there is a small standard charge increase. So overall, done obviously a comprehensive review of the business plan, make sure it's focusing on the things that's really important for tenants and residents in the city, what we can do during this period to support our communities, how we work together locally with other services and organisation, whilst also making sure we are improving the existing stock, making sure obviously it's a good standard, and increasing the number of affordable homes in the city for rent that our tenants can access. And as we've talked before on this, Sheffield has a significant shortage of affordable housing, so it's so the HRA on what it can do to help bridge those gaps. Happy to pick up any questions.
Thank you, Janet. Thank you for your report. I can see just one comment. So Councillor Paul Wood, if you'd like to make your comment, please.
Yeah, thank you, Leader. I want to personally thank my housing officers for an amazing job, really, in a very difficult period and going through COVID as well. When I inherited this portfolio, the number of planned developments in social housing was negligible, which would have never been able to deal with the ongoing problem. That was taken from around 1,500 properties to the 3,100 in the programme. And as Janet said, we're looking at taking that up by another 1,000. What I think is a great testimony to our city is that both Janet and I were asked to be keynote speakers at the two major housing conferences last year about Sheffield having the most progressive social housing policies outside of London, and we intend to keep that position. We've redeveloped as well through the HRA the repair service and put in a complete new management structure into that. We're installing the most advanced IT system, which will be coming online in April, which will give a massive benefit to all of our tenants. In addition to that, we're launching this week with Cabinet approval the first shared ownership scheme within the city, which was a great ambition of the previous leader. And the 12,000 active homeless requests we get, although we have figures of 40,000 on the housing register, we have actually a problem of a 12,000 number, which is the active ones, the active figures that we need to address. So if we can keep building on this programme, I think it's a fantastic news story for the city. And I also want to thank Councillor Bob Johnson, because he's been key in working with me in his former role, cabinet role, in being able to develop and deliver these policies. And we've, for the first time, done a trial period with modern methods of construction to see if we can speed up the delivery of houses, which was basically Bob's decision to push that forward. And we'll be assessing that over the next 6 months and see if we can get the delivery of our social homes brought forward considerably to what our initial plans were. I'm sorry my voice is going. So I just want to thank everybody, my fellow cabinet members who've supported me in this, but especially the staff who've worked tirelessly to deliver what I set as the priorities within this. So thank you all very, very much. Thank you, Chair.
And thank you, Paul. Thank you for your kind words. I've got another comment, please, from Mark Jones. Mark, if you'd like to make your comments.
Thank you, Chair. Thank you for the report, Janet, and thank you for the good work you've been doing, Councillor Wood, in pursuing this. I'm really pleased to see that the environment and environmental considerations are at the centre of this going forward. It is appropriate that we have to deliver the housing stock that our city needs, but it's also important that we deliver the environment and take the actions that we need to deliver the city that we want in the future. So we are all too painfully aware of the immense cost of transitioning to a net zero city, and we will need funding from government to help achieve a lot of those ambitions. But it's really good to see the council taking a stance and pushing our aspirations and pushing our expectations on what the housing stock will look like, because it's critical that we act as an exemplar for the rest of the city to show what can be achieved when we put our minds to it. So really appreciate this work, and good luck on delivering these aspirations and goals. Thank you.
And thanks for your comment. And once again, thank you for your report, Janet. And moving on to our final item, I believe, item 12 is the Sheffield Street Partnership.
Do we need to, Chair, agree the recommendations?
Apologies. Yeah, that would be useful. Could we agree the recommendations?
Agreed.
Yes, Chair. Well done, everyone. Well done, Paul. Great news.
Thank you, everyone. Sorry. So thanks, Janet. Moving on.
Thanks, everybody.
Moving on is item 12, the Street Tree Partnership Working Strategy, consultation feedback. And it'll be presented by Karen and Lawrence.
Yes, thank you, Chair. Hi, everyone. My name is Karen Ramsey. I work in Place Operational Services. And for about the last 18 months, since about August 2018, one of the projects that I've been working on is the development of the new street tree strategy for Sheffield. And so the report today is a report on the consultation that we did last summer and some of the feedback from that. I'd also like to introduce Lawrence Haybrook. Lawrence joined us last October as part of the National Graduate Development Programme and is working with me for about 6 months on his first placement in the council as part of that programme. And so has been doing some work on the street tree strategy and in particular on the consultation. So he's joining us today as well for
Hi
this.
everyone. And
I know you've all had the full consultation. Sorry, Lawrence.
that was a slight delay. Hi everyone, and nice to meet you, and it's great to be a part of the council.
So I know you've all had the full consultation feedback reports. With permission, Chair, I do have some slides to run through that highlight some of the key points coming out of the report, if there's time to do that.
That's fine, please.
Okay, so I'm just going to share my screen.
Thank you, Karen.
So I'm hoping that you can all see that. Yep, got a thumbs up from Craig.
Yeah,
So
thank
that's
you.
good.
Thank you.
So just as a bit of background to the actual street tree strategy itself, this is going back to December 18. I'm not going to go back to the full history behind this, but in December 18, there was a joint position statement that was published between the Council and INI and Sheffield Tree Action Group's steering group. And this was following mediated talks around the management and maintenance of the street trees. And one of the things that was agreed in that position statement was that the future management of street trees would be set out in a new street tree strategy. So in August 2019, a strategy development group began to meet. And again, as agreed between all the parties, that was independently chaired by Liz Ballard, who is the Chief Executive of the Sheffield and Rotherham Wildlife Trust. And, I really would like to express thanks to Liz who's done a great job steering us through this process and continues to do so. We've signed off the working strategy and published it as a working strategy last March. And the reason that we chose to do that as a strategy development group was because we were aware that we wanted to give people an opportunity to take a view and have some views on some of the proposals in that strategy to help us work towards a final strategy, which will be coming to Cabinet this March for sign off. So we published in March, and then from July to October, we ran the consultation. So our approach to consultation, we specifically asked for views in the working strategy on the vision that we outlined in there. The strategy itself is structured around 6 outcomes, and there's a range of actions set out in the strategy to deliver those outcomes. And then we also asked about ideas and suggestions for a representation on a new Sheffield Street Tree partnership. So we launched the consultation mainly on Citizen Space as an online consultation. We also offered postal versions of the consultation if people wanted to take that up. We didn't actually receive any requests for that, so primarily it was done through online, apart from some organisational responses that were written into us. The launch coincided with Sheffield Tree Week online, which was held last year, last July. So we did a seminar at that event just to launch the consultation and to make, to publicise that. And there was a bit of press around that as well to publicise that the consultation was live. And we were also conscious that we wanted to try and encourage as many different groups as possible to respond to the consultation. So Liz, as the chair, wrote directly to about 65 organisations, some organisations based in the city, some national organisations, and also to all the tenants and residents associations, inviting people to respond to the consultation. So just in terms of the responses, overall, we had 282 responses back. As you can see there, the majority were from individuals. We did have 11 responses back from organisations and with some really helpful suggestions. And so in our analysis of the responses, there was a few things that we wanted to look at. And one was a comparison of the socio-demographic characteristics of the individual respondents compared with the general population. And what that indicates that there was some overrepresentation in the responses from certain demographics, so people aged between 55 to 74, people from white backgrounds and people living in the west and southwest of the city. And we had underrepresentation from younger people, so people aged between 16 to 34, people from BAME backgrounds, and people living in the east and northeast of the city. So we checked this out with colleagues in our research team, and broadly speaking, this type of response bias is not uncommon or atypical in consultations that are open to the general population of Sheffield. And even though we did write out to organisations that were representative of a different range of groups, and also to the Taras, we didn't really get much response from that. So it's something for us to think about as we take this work forward. Just generally on the overall strategy, we had several respondents, many respondents actually, expressing support for the strategy, and also the fact that the strategy was a collaborative effort between a range of partners. We also had some challenge in the working strategy for not quite fully addressing some of the adverse effects that street trees can cause. And we know that street trees are very particular in terms of the environment that they grow in, and there's some particular challenges there. So some of the issues, things like causing damage or creating hazards on pavements, particularly we had comments about access issues being created by limiting pavement widths, and also things like limiting parking options and negative health impacts where street trees might be blocking out light. There was also some concerns that came through in the responses about the current and future role of AME, the council, and the Sheffield Tree Action Groups in the future management of street trees. And perhaps more importantly, the general feeling that maintaining a progressive attitude, resolving conflicts early, and ensuring that a wide range of views are taken into consideration is something that came out of the consultation, and that's something we want to take forward with the new Street Tree Partnership. So we asked for some feedback about the vision, and I've summarised the vision here. I'm not going to go through all of this, but I just wanted to pick up 1 or 2 points. So the top 6 bullet points are the benefits of the street trees that we set out in the working strategy, and there was generally support for these. particularly picking up things like Sheffield's status as a green city. That's something that's been around, in Sheffield for a long time. It's important for attracting visitors, students, new worker, investors, and there was a view that street trees were a part of that. Linking to things like climate change, one of the benefits that we had in there was helping to reduce carbon emissions, but we've had quite a bit of feedback saying that we should clarify that and really talk about offsetting or mitigating carbon emissions with street trees rather than reducing. And there is a report that underpins the strategy itself that does an analysis of the benefits that street trees bring. Although it does bring some benefits around helping to offset carbon emissions, the contribution is quite small. And I think I just wanted to pick out as well the improving our health and well-being. It's been mentioned in the context of other presentations this afternoon, and certainly the importance of the green and natural environment came through in the consultation. And for some respondents, street trees were a representation of nature on their doorstep. So particularly if they did not have access to green spaces nearby, the nature on the doorstep for them was in the street trees, and that there was a value in that for them. Additional benefits that people felt street trees brought were enhancing the local community, and in particular being part of the history of an area or the heritage of an area. The intrinsic value of street trees and just improving the aesthetics of a place. How does it look? How does it feel to live there? And also interestingly, providing a source of food. And there are some growing schemes around community orchards and things like that. So we also asked of 6 outcomes that we proposed in the working strategy, which are listed there. And again, we had some additional suggestions. And one of the ones that came through quite strongly was engaging the wider public in the value of street trees and the benefit of street trees. And that might be through taking care of trees in the local area, but a kind of all ages engagement program from children in schools right through to adults, how they might get involved, the benefits of street trees, how we look after and take care of trees on streets, and some of the challenges that brings. It also links into things that we might like to do in the city around protecting and supporting biodiversity and wildlife in the city. And again, we know that that's been important to people through the lockdown because it's been a source of comfort to a lot of people, I think, that they're able to get out in nature at a time when so many other things are so limited. And also how we might value and preserve our mature street trees. So I just want to highlight some of the consultation themes that came through. I've mentioned already at the top there, this idea to engage with all members of the community. One of the suggestions and actions coming out of the working strategy is for community planting schemes. So looking at how people can raise funds, and we would support them to plant street trees in their area. And there would be a kind of shared responsibility for looking after those, particularly in the first 3 years when it's really important to take care of street trees. I've already mentioned the aesthetic value of trees and the biodiversity and wildlife. Just want to pick up again about the green city status. There were certainly some that came through quite strongly in the consultation was this pride in Sheffield being a green city and a desire to be a pioneer in this area and showing the way for other cities to follow, and how in the future we look after and take care of our street trees. There was also some comments about making sure that our decision processes, and this is really to do with where we're making decisions about removing and replacing street trees, that we need to make sure that that decision process is much more transparent. And again, one of the actions coming out is that our colleagues in highways maintenance, work with Amy, are working on a process for the decision making that builds in public consultation and publishing decisions to make that process much more open. Again, there was some concern that the strategy didn't recognise where there are legitimate issues related to street trees that might be causing issues for some people, and that might be to do with blocking out light or damage to properties. So that's something that the partnership needs to take into consideration, as well as things like the safety of streets and the integrity of highways, particularly for people who might have disabilities or mobility issues, just getting around their local neighbourhoods if that's problematic for them. One of the other things that we're keen to do as the partnership is to foster this idea of shared custodianship of street trees, and we had some suggestions about things that we could do. So starting our own tree nursery in Sheffield, setting up tree sponsorship schemes, creating tree trails and wildlife corridors, which could be a really good part of an engagement programme. And we're also looking at this idea of an interactive street tree map, which would be an interact map where any member of the public could click on a tree and find out information about what's happening with that tree, particularly if there's any maintenance work that's going to be done there. We also had some issues that were flagged up where there's sometimes an uneasy relationship with street trees, and what role can they play on things like tackling verge parking and reducing traffic noise and pollution. So we did have some comments that were related to street trees, but not specifically about some of the propositions in the strategy. But however, we are speaking to colleagues in other services in the council about how we might pick up and address some of those issues. So just in terms of the next steps, one of the things that we asked was for suggestions for a new Sheffield Street Tree Partnership. We're very conscious that the core group that developed the working strategy was quite small. The consultation enabled us to hear more views from a wider group of stakeholders. And we're with the strategy development group, we're looking at the future arrangements for the partnership to come up with an arrangement that allows us to bring in that broader range of views and to involve more partners in that work. And one thing I would say that even though that the consultation has concluded, the formal consultation, the partnership is really clear that the way we'd like to continue to work is to continuously engage with stakeholders and communities and involve them in some of the actions that we're taking. We want this process to be always evolving. Having the strategy is one thing, and it's a great step forward that partners have worked together to produce this. But the next step is absolutely to take forward some actions and to demonstrate some change in the way that we do things. That's really important. And we also want to make sure that we're linking in with some other key policies in the city, particularly around things like climate emergency and the future development of the city, be it the city centre or district neighbourhoods. And one that's absolutely high on the agenda at the moment is obviously the health and well-being of all the residents in the city. So the report itself is recommending that Cabinet receive the feedback from the consultation, and also that we'll use the consultation feedback to inform the strategy, the final strategy, which we'll come back to you in March, to help inform the future arrangements for the Street Tree Partnership and also the future programme of work for that partnership. There's many things that we could be doing in this area. For this next year, we need to keep our focus and make sure that we deliver some of the commitments that we've made. And as I say, we also want to work with other services around helping to shape new council policies and processes, where it's appropriate and relevant for us to do that. So I'm going to stop sharing now.
Thank you. Thanks very much, Karen, for a really detailed report. I have one question and a comment, so I'll go to questions first. Jackie, if you'd like to ask your question, please.
Thank you very much, Councillor Johnson, and thank you very much. Where are you? You've gone. There you are. Thank you very much, Karen and Lawrence. You obviously did a lot of work on this. Just a question. In the report, you said there was an overrepresentation from white population 55 to 74 in the west and the southeast, and an underrepresentation. You probably won't know the figures between 16 to 34-year-olds, people from BAME communities, and also the northeast and east. Of the 282 individual respondents, could you give me the number? Do you know the numbers of how many came from the north and the northeast? What was the breakdown of that? You don't have to give it me now. If you could send it me, I'd find that useful, please. Just to understand when you say under and overrepresented, is it there were 2 people from the north and northeast and only 3 people who were between 16 and 34? And then there was only 5 people who from a BAME background. So it's just good to know that. The other thing is, I noticed in your report that you sent us that people felt that the strategy, there wasn't much emphasis on the maintenance of the trees. And I'm just speaking from being a councillor for Burngreave Ward and Norwood and Bishopholme, who it's an area in our ward, and there are people there when we're talking about health and well-being. Their questions to me, and they're asking me to do something about the trees, is about their mental health. It's about their physical health as well. When the trees are blocking light from their homes, from they're worried about the roots all in the pathways there, and quite a lot of elderly people in that area. And when I was reading it and hearing you talk about it, there was a lot about really positive things. Don't get me wrong, I think they are really positive, but surely our tree strategies has to have something about maintaining it so it is a lovely place to go out to when you walk out, and it is nice to be out there and feel the nature's in front of you, not that you feel you have to switch your light on all day because you can't get any light through into your front room, that sort of thing. So it would be great to know what you felt about that in terms of how you came up with the strategy and whether that will influence the strategy in any way. Thank you, Chair.
Just on your first point, Jackie, on the breakdown, I can certainly send you the numbers. In the consultation feedback report, there's a heat map that shows the breakdown of where the responses came from. So that'll give you a bit of an indication. But I can certainly send you the numbers broken down as well. On the second point around the kind of, I suppose, the negative impact of usually it's poor maintenance of street trees. We've had Amy were involved with the development of the strategy, and so we've been working quite closely with them around the maintenance issues and also with our highways maintenance team. I think often what happens, it's the poor maintenance of the trees that can often lead to these problems. So certainly one of the things that's come out of the consultant is that the strategy itself probably didn't focus on that sufficiently. That's not to say it hasn't been discussed with the partnership, but it certainly has been. But the consultation feedback has really given us some focus around what some of those issues might be for people, and blocking out light is one that's come up quite a bit. But there might be solutions that help with that are to do with the maintenance of the street tree.
Thank you very much, and thanks very much. Sorry, Chair, just to say I've noticed on the map it actually says S1, S3, S4, S9, S13 and S14. And S36 there were no, it says no responses from those areas. So yeah, thank you. I've just seen it, thanks.
And thanks for your question, Jackie. Mark, if you would like to make a comment, please.
Thank you, Chair. Yes, indeed. Thanks for the presentation, Karen, and good to see you in the chamber, Lawrence. And I know you've been with us for a while, and it's been really helpful to have you here. It really is our intention to make our street tree strategy and our wider tree strategy in collaboration with Councillor Lee a true exemplar and a global leader for how trees can be managed, and embrace the natural world in our urban human environment, because we think that's really, really important. Karen, Lawrence and Mick have worked with partners across the city to bring about this report and do this consultation, and I think it's testament to their endeavours that we've done so well and had such a positive feedback on this. And it should also be noted that the Ombudsman in previous correspondence has also acknowledged the work that we are doing, that we are moving to, and the progress we've made as a city to make sure that we are embracing the populace in collaborative processes and making sure we consult in a full and comprehensive manner. So to all those people involved in producing this report, I'd really like to thank them, and thanks Karen and Lawrence for bringing this this overview today. Thank you.
And thanks for your comment, Mark. I've just picked up a couple of other comments, so if I could just bring Julie Growcut in, please. Councillor Growcut.
Thank you, Chair. Yeah, I think it's a really interesting report, and again I think thanks to everyone who's been involved in it, particularly the people who did take part in the consultation. Well, most of my ward is S36 that didn't take part in it. unfortunately, because the picture behind me is actually part of my ward. While we don't actually have many street trees in it, the row of blossoms you can see behind me is a row of street trees within the ward, which is why I specifically put the photograph up this afternoon. And it just shows you that, you know, the beauty, the value, the benefit that street trees can bring. Having said that, this morning I've spent a lot of time listening to people complaining about blocked drains because of leaves, you know, with all the flooding and the problems that come. So I think we've got to be very careful that we look at both the advantages and the disadvantages and make sure that we do get the balance right, because again, planted in the right place, and I know, Mark, you've been out in my ward planting trees in relation to supporting flood defences. They can be very valuable, but again, making sure that we've got the infrastructure where we've got the street trees so that the drains and things are cleared is vitally important to many people. I particularly liked the idea that you've got about clicking on a tree and finding out a little bit about where its status. I think that would be really nice if we could put information on there about the tree, about habitats that are attracted to the trees as well, because I think that would make people value them a lot more. I think it will get younger people particularly engaged and enthused about, you know, looking after them and valuing the trees, because I think in Sheffield we do have a great heritage and we are very proud of the fact that, you know, we are a very green city, and I think that that would just make sure that while we're doing that, that will be something that we could continue along. So I would just ask, if you can, that you would look at that. And I would also be keen, if we possibly can, to look at ways that perhaps we can get local people from the north of the city engaging in this project. We've got some great local community environmental projects that are ongoing, and you know, if I need to do a little bit of work going around local people to find out who might want to be involved and get engaged in this project, then I'm very happy to do so, to make sure that the north of the city is covered. Thank you.
And thank you, Julia. I have a final comment from Councillor Mary Lee. Mary, if you'd like to make your comment, please.
Yeah, I just want to say we can claim Sheffield is the greenest city. I think in Europe, I think that's what we can safely claim that. And there are around 4 million trees in the city, across the city, and they're not all in the Peak Park. They're spread across the city. But I do understand that in some neighbourhoods where maybe green space is at a premium and it's not as readily available, that the street trees are really important to enhance that neighbourhood and important to the communities there, because it may be that makes up for the lack of green space. And I'm particularly thinking of places like Nether Edge, where the trees do enhance that neighbourhood, and there's limited green space. So I just want to thank also Karen and the team for compiling, for developing this strategy, and I hope, you know, the people that become involved in the future and help to monitor and look after our trees do also take note of the fact that there are some people that have got disabilities and do find negotiation of our pavements quite difficult. And you know, Jackie has mentioned lighting and access to light and all those other issues are equally important. So as we move forward, I'm sure we can all work together to bear in mind all those issues.
Thank you, Mary. And this report contains a recommendation for approval. Could I ask members to whether they approve or not, please?
Agreed, Chair.
Agreed.
Thank you. And before we move on to details of the next meeting, could I just ask if any members have got any urgent other business they'd like to raise before we close the meeting? I believe Councillor Wood's got a comment or a statement he'd like to make. If you'd like to.
Yeah, thanks, Chair. It's opportune to do this at this meeting, I believe, because part of the housing repair service restructure was that we looked at the retirements over the next 3 years and our average staff leaving, and that let us develop a plan to offer employment to a number of apprentices. They should have started last September, but I'm pleased to announce 39 of the 45 will be starting their course on February the 1st. And I'm sure as the Cabinet we would wish them all the luck in the world, that they have successful apprenticeship with us, and because of how we've planned those apprenticeships, if everything goes according to those plans, each of them will be able to take a full-time operative job with the council when the apprenticeship finishes.
Fantastic.
So as that happens on February the 1st, I'd like to just get the Cabinet to send a message to them through the Executive Director, welcoming to the council and wishing them all the best for the
Great news.
future.
Great
That's
news. Well done.
fantastic news, Paul, and I'm sure
Well
we can all join in welcoming him on board on the 1st of February. And I guess that brings to an end the meeting. The next meeting of Cabinet will be held on Wednesday, the 17th of February at 2 p.m. And thank you all for your attendance. Thank you.
Thank you.